Hi, everybody. Dr. Chestnut here again. The reason I'm laughing is because I just recorded this thing without volume. So, yeah. Anyway, here I go again. So, I get so many requests to talk about what's going on with this COVID-19 and just to see this through a lens of my expertise, which is really baseline health and immunity. So, I really want to just reemphasize the importance of baseline health and immunity and all this because that's the variable, that's the factor that's determining all of this stuff. So the reason we're having a social isolation and shutting down of the economy, which by the way is devastating to most people, and probably going to end up causing more problems than perhaps COVID. I mean, we'll have to see. I'm not looking back as the Monday morning quarterback and criticizing anybody, but I'm just saying we really have to look at what's going to happen with, as we see unemployment go up, what happens to addiction and drug addiction deaths and depression-related suicides and things. So these are important issues we're going to have to talk about because data is data, and we're going to have to talk about it, but that's not the topic for today. What I really want to talk about is just the importance of baseline health and immunity, because when we look at this, we have to understand that's the variable that's determining whether or not you get no symptoms, and your body just kills that, your innate immune system kills that quickly, or whether or not you've got to kick in your adaptive or humoral or antibody immune system as well, and then you're going to get a little more symptomatic but still be okay, or whether or not you have immunocompromise and you're going to end up either in a hospital because you have not enough immune function, or you end up overreacting and getting this huge inflammatory response in your lungs that can also cause problems, again, from a defective immune system. And all of this is going to be related to what I'm talking about today, which is vitamin D, vitamin A in the right ratio, A and D, and then omega-3 as well. So I just really want to talk about the importance of that baseline health because, remember, the virus is the same for everybody. Everybody's getting infected with the same pathogen or the same virus. So the thing that determines how sick you get or whether you have to be hospitalized or not, which is really the major factor, whether or not the healthcare system is going to get overwhelmed. That's why we're in all this social isolation and economic shutdown, for one reason only: to stop people from overwhelming the healthcare system. I think initially they said it was going to be because the death rate was so high, but now what we're finding out is that as we find out that 40 to 80 more times, according to the study out of Stanford, 40 to 80 times the number of people are infected that we know about, it means that the death rate is really low. It's probably as low or lower than the flu at the end of the day, because as that denominator gets bigger, the number of deaths is a ratio of the number of deaths over the number of cases. But we know the number of cases is underestimated by 40 to 80 times, which means the mortality rate is overestimated by 40 to 80 times. And remember, they're also overestimating the number of COVID deaths because they're attributing virtually non-tested people who have passed away, who have died, if they had flu-like or cold-like or COVID-like symptoms, they're attributing that to a COVID death, which is absurd from a scientific point of view, but that's what's occurring. So the people who are dying from COVID-19 is probably overestimated. The number of people who have it is way underestimated. So anyway, that's an important thing. I'll talk about that in maybe future sort of videos or whatever I'm going to call these things. So, but right now what I want to talk about is just understanding that the virus is the same for everybody. So the thing that determines how sick you get, whether you get hospitalized, is your level of baseline health and immunity. But the thing that determines your baseline health and immunity aren't treatments for COVID-19 or treatments for anything else. Treatments don't increase your baseline health. Treatments are there for people who don't have any baseline health or immunity because they're in a state of emergency. So the way to stay out of that state of emergency, to prevent these kind of things, the only way to do that is with baseline health and immunity. But the most important variable determining baseline health and immunity is certainly not going to be any drug or any other treatment. It's going to be your lifestyle. How you eat, move, and think. You remember, people who know me, I trademarked the term eat well, move well, think well 15 to 17 years ago. And, I've written this book, which I always try and get people to read because, who reads anymore? But if you read this book, the amount of information and scientific references in this book, it's just a unequivocal evidence that lifestyle is the most important variable determining this whole chronic illness pandemic and everything else. Remember, the chronic illness pandemic came first, then COVID came along, and you're going to have to ask the questions: why are so many people dying in the United States compared to other countries? Maybe because so many more people have diagnosed chronic illness. Maybe because you're consuming 60% of the world's pharmaceuticals and a lot of those pharmaceuticals downregulate immune function. I mean, these are questions and things that we're going to have to at least ask, as we go through this and start collecting real data. But anyway, so baseline health and immunity first of all, is enormously important all the time. And I've been imploring and pleading with people to see that for 20 years. But right now, at least it's coming to the forefront, because really right now, it's not often that baseline health and immunity really gets in sort of that acute emergency attention. But right now, everything related to this acute emergency with COVID is based on baseline health and immunity. And the thing that the greatest variable determining baseline health and immunity is quality of your lifestyle. How healthy are your lifestyle choices in terms of how you eat? Are you getting the proper nutrients in? Are you avoiding putting toxic things into your body? Are you getting enough exercise? Are you avoiding toxic sedentary living and toxic, postures all the time? Are you getting? How are you thinking? Are you emotionally resilient? Are you emotionally fit? Do you have a positive attitude? Do you focus on the solutions rather than the problem? Are you optimistic versus pessimistic? All these things I've just talked about are absolutely unequivocally proven in the literature to have a major effect on your health and your baseline immunity. So I'm going to, as I go through this series of videos, I don't know how many I'm going to do, but I seem to be motivated for the time being. So I'll probably one a week or so, just because the demand's been so high. So anyway, what I want to talk about now then is, what are some things that you can do right now to really increase your baseline health and immunity? And so today's topic is going to be vitamin A and D together in the right amounts and the right ratio, along with omega-3 fatty acids. So I think the last video I did, or at least one of the last posts I did, and the newsletters I've been doing for the last few months, you can go and get a public newsletter for free at eatwellmovewellthinkwell.com, or my other newsletters for docs are at thewellnesspractice.com or innatechoice.com as well. So anyway, I just want to point out a few things, because everything I do is going to be evidence-based. So the reason why I created a supplement company called Innate Choice, just for the essential nutrient system, because I don't market or sell anything other than essential nutrients, because essential nutrients are unequivocally already proven to be required by human beings to express health. And it's already proven that if you're deficient in these essential nutrients, that you're sick, that your body cannot function properly. So you're not expressing your potential for baseline health and immunity if you're deficient in these things. So this is an important time to make sure we make no false claims. I mean, it's always important, and that's always dear to my heart, but it's really important now. But I want to show you some of the evidence of the importance of these nutrients in terms of your baseline health and immunity. So some of these things I've gone over before, but here's a great study out of the British Medical Journal that was published by Bergman and colleagues in 2012, I believe. And this is a really good double-blind, randomized controlled trial with supplementation with vitamin D. And what they showed was, as you supplemented people with vitamin D, it significantly reduced the risk of respiratory tract infections from viruses like influenza and cold, rhinovirus and coronavirus, or cold viruses, influenza viruses, the flu virus. So that's a really important randomized double-blind controlled trial. And here's another one. Looking at vitamin D and immune function, which was published in the journal Nutrients in July 2013. Again, just looking at the evidence of the importance of vitamin D for proper immune function. I don't want to get too deep into the science, but what vitamin D, why it's so important for your immune function is, vitamin D is actually, there are receptors on your immune cells for vitamin D. And if you don't have enough vitamin D, then those receptors don't get that vitamin D, and that vitamin D goes to the receptor cell, goes inside the cell, and then goes into the nuclear membrane and affects the epigenetic expression of that immune cell. And so one of the things immune cells do is they release things like cytotoxins, which can kill viruses. They can engulf them, like phagocytosis over a virus. So we're talking about your innate immune cells right now. So your innate immune cells also release things called antimicrobial proteins, which again, vitamin D has been shown in the literature to be deficient vitamin D, deficient the production of antimicrobial proteins. And what's a virus? It's a microbe. And so these things are really importantly tied to vitamin D and vitamin A as well, by the way, and omega-3 fatty acids. So that's, and the other thing is that, so that's making sure you have enough immunity. But the other thing that's really important is making sure you don't have too much immune or a hyperreactive immune response. So you get that hyperinflammation in the lungs. And the thing that's really important for that are your T cells, your Treg or T regulatory cells. And again, very shown in the literature that I'm showing you, that those T regulatory cells cannot work properly to dampen a hyper response, to make sure you don't get a hyper response or a hypo under response. that you need vitamin D to regulate the proper function of your immune system and these Treg cells and your innate immune cells. So that's really important. Again, this is kind of interesting because I've been talking about this for a long time, and now even since, right at the very beginning of this in January, February, but here's a study that came out in March and published in peer review in Nutrients, and it's just talking about the importance and evidence that vitamin D supplementation can reduce the risk of influenza and COVID-19 infections. That's March. In April, also in 2020, came out. This is from the Irish longitudinal study on aging, the TILDA study. And again, what they're showing is vitamin D deficiency in Ireland. And again, what they're recommending is everybody needs to take vitamin D, especially the elderly, because they're inside a lot. And even what we know is the reason why influenza and these viruses are seasonal is because they occur in, it's not temperature, it's the amount of sunlight, because sunlight is what we require to convert cholesterol into vitamin D. But nobody gets enough sunlight anymore because we either have sunscreen on, which blocks it, or we have clothes on. So even in sunny climates, it's just not enough. So that's why there's seasonal flu, because and by the way, in the tropics, it's not in the cold season, it's in the rainy season, the hot season, because there's cloud cover. So there's tons of information on this. I don't want to dive too deeply into it, but there's just so much sort of evidence for the importance of vitamin D in our immune response. And again, people are indoors, especially the elderly who number one are malnourished, but they're also not getting enough sunlight, and people with dark skin. So if you have darker, more pigment in your skin, you produce less vitamin D by the little amount of sunlight anybody gets these days. And so, and you're seeing this all actually come out in the data that people with black or brown skin are more likely to have serious illness from COVID. Now, I know there's some socioeconomic issues in that, and I'm not denying them in any way. But we're going to have to look at the vitamin D issue as well, and that's really important. And it's so inexpensive, we can really make a big difference. So, this is one of my favorite papers on vitamin D. This is the Martineau paper, again published in British Medical Journal, and this was a systematic review of all the vitamin D, all the studies on vitamin D and respiratory and defense from or immunity to upper respiratory tract infections, viral in particular. And so, what I love about that study is that it actually, because in the past, there's been some sort of controversy saying, well, some of the studies on vitamin D really show a significant reduction in respiratory tract infections, but there's some other studies that don't have as strong an effect. So, we're not. It seems to be, the evidence seems to be equivocal. But what he did, which is what I've been arguing for years, but what he did and his colleagues did, Martineau et al. In British Medical Journals, they said, well, wait a minute, let's look at the raw data and let's see if we can tease out why some studies got great effects and others didn't. Is it just vitamin D that's not effective? And they found out no. Vitamin D given in the right dose, about at least 4,000 IUs a day for adults, and not given in a mega dose. A lot of these studies include a major bolus dose of like 100,000 IUs, and they showed that not only does that increase the chance of adverse effects, but it decreases the effectiveness. So when you control for that, and you give the proper dose and a daily dose rather than a big bolus dose, they all show a very significant benefit of vitamin D supplementation. So that's another important study. And I'm along here, so I'm going to try to make this 10 minutes or less, but I'm at 13. But anyway, here's one really showing the importance of vitamin A and D together. So that's really important because vitamin A and D actually upregulate each other's receptors. So the VXR and the RXR receptors, for those of you who are kind of biochemically sort of literate. But anyway, and then another one. This is one of the ones I reviewed in my research review. This is effects of omega-3 fatty acids as well. So one of the things that is the easiest, most inexpensive, quickest ways to increase your baseline immunity and your baseline health is to supplement with the right ratio of vitamin A and vitamin D and omega-3 together. So guess what? And again, as I go through these videos, you're going to see that this is important for virtually any chronic illness, cardiovascular health, reduced risk of breast cancer. I mean, you'll see that because these are essential nutrients, they're involved in so many things, but especially for immune function and baseline health. So this is the only supplement in the world that's half cod liver oil and half fish oil together. Why did I do that? Because cod liver oil has naturally occurring pre-formed vitamin A, not beta-carotene, fully formed vitamin A, naturally occurring, right? It's not synthetic, and it also has naturally occurring vitamin D and omega-3, and then you put that in with the fish oil for the rest of the omega-3, and then add some extra vitamin D from lanolin. So now you've got the perfect ratio of A and D. You've got the perfect amounts of omega-3 and vitamin D and vitamin A. So that's really important. You get that at innatechoice.com, I-N-N-A-T-E choice.com. You can also go there and get some lots of information. You can go to eatwellmovewellthinkwell.com and get a free newsletter. You don't have to buy anything, just get some information. So anyway, I'm already over, and it was quicker last time when I didn't turn on the volume, so I don't know what's going on here, but I'll talk to you in about a week or so. I'm going to try and put as many of these out as I can, because I can't deal with the emails and the other requests through Facebook. So I hope that's informative, and I just implore you, please, to get yourself sufficient in these nutrients. Okay, take care until next time. Bye now.